Hi, everyone. I'm just checking in to give a quick public service announcement about this virus that we're all kind of experiencing right now. So I don't know about you guys, but here in California, it very quickly went from summer to winter, like overnight. And it's showing up like that in the urgent care. So what I'm seeing a lot is it's not COVID, it's not flu, but it's terrible, right? I'm not seeing a ton of COVID in urgent care right now. It is out there, and I don't mean to minimize it, but, and the cases that I have been seeing recently are pretty minimal, right, in an urgent care setting. Doesn't mean that, in the hospital settings and other places, they're not seeing more severe cases, but I'm just not, okay? What I am seeing is some really sick patients. And first of all, I want to kind of just give you a rundown of what really is viral versus bacterial. So if you have a sudden onset of fevers, chills, body aches, you have a headache, you are just fatigued, you have nasal congestion, sore throat, cough, your ears feel plugged, you don't have a sinus infection, an ear infection, strep throat, and bronchitis, okay? You have a virus, and viruses typically will be a little bit more systemic, meaning that some people with this virus that I'm seeing are also having some vomiting and diarrhea. So most viruses will typically peak at about day 5, which means you might get worse on day 2, day 3, day 4, maybe even day 5. It doesn't mean that, you're getting sicker. It doesn't mean that you need antibiotics. It just means that it's going to take some time for you to get well. And it's not fun. It's pretty miserable. It did make its way through my house. And, this is a nasty one. I mean, I've had influenza myself. I've had COVID myself. And from what I'm seeing, this flu that's going around, or this version of the flu, whatever it is, because a lot of my patients are testing negative for flu and COVID. And, it's just another variant of a respiratory virus. So a bacterial infection, you guys, like if you have strep throat, you don't have any of those other symptoms. You might have a fever and a headache. You might have a little bit of nausea, but you have a very sore throat. You don't have nasal congestion. You don't typically have a cough. And if you go into urgent care and we do a rapid strep test and it's negative, you don't need antibiotics. If you don't agree, you can ask them to do a throat culture, which will take 2 to 3, maybe even 4 days for it to grow out, which is a safe time frame, assuming that you've sought care within the first few days of your illness. But if you do not have strep, you don't need antibiotics. Short of having an abscess on your tonsil, you don't need antibiotics. And people don't realize that antibiotics can have negative effects, right? So obviously there are rashes and anaphylactic reactions, allergic reactions. Some antibiotics will cause some really bad gut upset, meaning vomiting or diarrhea. So serious that you can actually get C. diff, which is an overgrowth of bacteria in your intestine that can be nasty, that require more antibiotics, sometimes even fecal transplants. So we don't want to take antibiotics. People think they're very benign, and they're not. I've seen patients with Stevens-Johnson syndrome, and that's a very serious condition, sometimes fatal side effect of antibiotics. So the other long-term effect of taking antibiotics that we don't need is that we're killing off good bacteria, and we're killing off good bacteria that are educating our immune system and keeping us healthy. So if you're taking antibiotics, you're in the long run suppressing your immune system, okay? You are affecting your long-term gut health. You are increasing your chances for things like autoimmune disease, okay? So we don't want to be disrupting that microbiome. Sometimes antibiotics are necessary, and I haven't thrown away my prescription pad, and I do write them. But if we do have to go that route, and you are on antibiotics, I can post a follow-up about what you can do to really take good care of your gut health if you do end up on a round of antibiotics. That being said, well, what do we do? Right. So if you have a virus, there's a lot that we can do. Okay. So first and foremost, if you're the type of person that tends to get sick often, you should probably work with one of us, a functional medicine practitioner, so we can figure out why. Why is your immune system suppressed? Why is your immune system not doing its job? Is it chronic stress? Is there something going on in the gut? Do you have some sort of nutrient insufficiency? Do you have some sort of toxin or other chronic infection that is not allowing your immune system to show up the way that it should? So that's, that should be done and taken care of first. But also, there's a lot that we can do. If you feel like you are the type of person who catches every little cold that goes around, or you stay sicker longer than everybody else, or it knocks you out and you're in bed for 5 or 6 days, then maybe we want to think about supporting your immune system. And some really good, just basic nutrients to help support your immune system are things like vitamin D, zinc, vitamin A, quercetin, vitamin E, omegas. Okay. Those are things that we can do every day. One thing that I love, I went through a period of time where I was one of those sickies where I was sick all the time. I also happened to be living in a moldy house at the time, and that was what was suppressing my immune system. But I was sick all the time. And one thing that really helped was I got out of the moldy house, right? Because that was slowly killing me. But the other thing that I did that really reboost my immune system was use something called transfer factors. And I will put links in the comments below on where you can get these supplements, because you can't just go onto Amazon and buy supplements because it's not regulated. You don't know what you're getting. The good supplement companies do not sell on Amazon because they're very aware that there can be counterfeit products, and we don't know if, Amazon has a great return policy. So you don't know if I had these supplements in my car in June and I left them there for a month and decided I didn't want them and sent them back. So you really don't want to be buying anything that you're going to put in your mouth on Amazon. Okay. So I will put links down below to where you can get these products that are from physician grade supplement companies that have been tested and have reputations for being high quality. And, we know what's in the labels. We know that what is on the label is in the product. Okay. So that's been tested and verified. So the first product that I like is something called Transfer Factors Multi-Immune. It's a blend of medicinal mushrooms that helps to raise your natural killer cell count, which is your first line of defense against infection. The second thing that I incorporated in was something called Transfer Factors Plasmic, and that is a blend of transfer factors. They're immunoglobulins. So what has happened is the companies have taken an animal and introduced this animal to low levels of these viruses, certain bacteria, and a couple strains of yeast. And that animal has created antibodies against the virus. Doesn't make them sick, but they've created antibodies. And then from the serum or the egg, they have extracted those immunoglobulins, and then they give them to you so that your body has more natural killer cells to fight. And then they are directed at the cells that are infected with the virus. So that's something that you can take every day to boost your immune system. Or you can take them when you've been exposed or when you're sick to help prevent or fight off that infection. So that is these two products that are my go-tos, and I have great results with those, both personally and with my patients. The second thing that I think is pretty non-negotiable, I practice myself just because working in urgent care and seeing patients face-to-face who are sick. I think that doing nasal rinses are very important in terms of rinsing out allergens, viruses, bacteria, things like that. But I use a combination of X-Clear packets, not the spray, the packets, and something called biocidin, which is a blend of botanicals that are good antivirals, antibacterials, antiparasitics, antifungal. It works for allergies. So what I do is I recommend that you get a ceramic neti pot because I don't want you putting plastic in your brain. Okay. So a ceramic neti pot, make sure that it's been made in the US simply just because we don't want lead-based paint from places like Mexico, China, or India. So we want to make sure that you're getting a ceramic neti pot and I'll put a link to this one I got on Amazon. It's like $12 or something. And you want to use distilled water. There have been reported cases of people who have gotten intracranial parasites from what was in their tap water. So if you're irrigating your sinuses out, you don't want to be adding things that can potentially go right into your brain, because your sinus is basically an opening in your bone, and right behind that is your brain. So the way that you use a neti pot is you'll fill this with warmed distilled water. I'll use a half a packet of X-Clear and 5 drops of biocidin. You'll use the pot in one nostril, and you'll want to stand over your sink and pour in the liquid because it will irrigate one sinus, the other, go to the eustachian tube and come out the other side. And you'll use the whole pot per side. And you'll have to play with your head position, because if it's too far back, it might go right down the back of your throat, and that's not fun. And if you're not positioned right, it'll just pour right out the other side. So you have to play with your head position. When you're sick, you can do this as often as you need to. You can't really overdo this, okay? You can also gargle with biocidin. It does have activity against strep and bacteria, viruses, things like that. And it really does offer some sore throat relief. So I use these two things, the biocidin nasally and orally. And if you're using this for prevention method, you can just do it morning and night. So if I'm traveling, if I'm working, I'm going to go ahead and rinse this out, because X-Clear also has antiviral activity. This is a mixture of saline and xylitol. So it's a biofilm disruptor, but it also has antiviral activity. So it can stop viral replication in the filter where we breathe in the viruses. Okay. So I think that's a good prevention as well, and also treatment. This is my treatment for sinus infections. So if you think you have a bacterial sinus infection or you want to prevent one, do this starting now. If you're having pressure in your ears, this will help unclog the ears. These are ways to keep you out of urgent care, because the last thing you want to do is go sit for 2 hours in a waiting room next to somebody who has the stomach flu or pneumonia and end up with something that you didn't go in with, okay? So the other thing, there's a few other things that I really like. If you want to start easy and gentle, I really like homeopathy. I forgot my silicosinum, but Boiron is, they come in a box, and it's a silicosinum. I'll put a link in the description below. And you can just take it per the instructions on the box, but that's a good homeopathic to help start to get your body to fight viruses, okay? And then I also really like these two products called Viral Fuge and Viral Immune Stimulator. So these are ways that we can naturally help to stimulate your body to start fighting viruses and the symptoms that go along with viruses, like the headache, the fever, the body aches, those sorts of things. So these are gentle ways to start to just tell your body to start showing up and fighting, okay? And then I also really like this V-Clear. This is another homeopathic that I'll again put in the link below, that really helps with respiratory symptoms. And then if you've got a cough, or we want to help with just overall support of the immune system, I added some elderberry syrup here. I do not like people who have autoimmune diseases taking elderberry every day, because I do not want to stimulate your immune system if it's already overreactive. I forgot one of the most important things. I'll link it in the comments below, but it is an immune defense pack. So it's a packet of supplements that has vitamin C, high dose vitamin D, quercetin, zinc, EGCG, lots of NAC, lots of really good things to help support viruses. So your immune system to fight viruses. So these are things that you could take every day in this packet. Or you can start taking that when you're sick or if you've been exposed. So I like to keep, this is my go-to. I keep on hand all the time, because I have 2 kids in 2 different schools who play sports, and then I'm in urgent care and, kind of doing my thing. So I have this on hand all the time. This is also my COVID supply pack. So if we start to get sick in any sort of respiratory virus, this is what I go to. The next product line that I absolutely love is the Beyond Balance product line. And so I use 2 things called IMNV and IMNV4. And these are herbs. These are herbs that are targeted to support your immune system to fight viruses. And then IMNV4 specifically for respiratory type viruses, including corona type viruses, cold viruses, flu viruses, things like that. And if you're having cough, shortness of breath, your chest is burning, right? When you're coughing, OGN Resp by Beyond Balance is a really good herbal support for the lungs. If you have asthma, right, you might need to use medication. You might need to use your inhaler. You might need to use steroids. This is not a replacement for good, safe medicine. So, if you do have any conditions like asthma, you may need medication. RSV might need to be looked at. You might need some medication as well. And if you have pneumonia, if you've had pneumonia before, and this feels like pneumonia, you probably should get in, get checked, get a chest x-ray, you know, have your doctor check your lungs. And you may need antibiotics in addition to this, right? It's not one or the other. I'd like to keep you off antibiotics if I could, but sometimes people need them, okay? And then the last thing I like to do is tea. I really think that like the Gypsy cold care is really good, or the Umka cold care, whatever you have access to is great. I usually will steep that with organic cinnamon or organic honey. I really like the On Guard by doTERRA. It's got a lot of good essential oils that are really helpful in stimulating an immune response and helping to fight viruses. Lots of lemon, and even a tablespoon of apple cider vinegar. The whiskey is optional. If you want to make a hot toddy, that's up to you. It can be very helpful for that cough in, you know, patients of age who that would not be contraindicated in. So I think doTERRA also makes a really good product called Breathe, and that's something you can apply topically to the chest. I didn't get that out, or you can put it in a humidifier and breathe that in. So these are all things that we can do to help naturally fight colds and viruses, and even some bacterial infections. Okay, so we can't out escape good sleep and rest, stay very well hydrated, and good nutrition. Now, fever is not our enemy, okay? If you're having a fever, that's your body's way of not letting the viruses continue to replicate and actually kill them. So if you can tolerate it, don't fight it, okay? If you're miserable and you're hurting and you just can't take it anymore, take some Tylenol or ibuprofen, okay? But if you can tolerate it, you know, ride it out, it will pass. Obviously, in children, we're worried about having febrile seizures, so you might want to be a little bit more careful with them. A lukewarm bath, a cool compress, cover them so they're not, you know, bundled in blankets and their temperature is rising. You can go ahead and uncover them and do natural things before you give them Tylenol or ibuprofen. But we definitely don't want, you know, any children having any febrile seizures either. So be very careful about that. And eating, right? More times than not, parents will come in and be so concerned that their child hasn't eaten very much that day. That's normal, okay? As long as your child is drinking, that's what I care about. Your child should have at least 3 wet diapers in a 24-hour period. And if that hasn't happened, that's concerning. And they may need to go to the emergency room for rehydration, okay? So they need to breastfeed. They need to, you know, if they're of age and they're doing that, fluids, you know, things like coconut water, watered down like white grape juice or apple juice, or, you know, an electrolyte replacement, broth, applesauce, those sorts of things, push those, okay? They'll eat when they're ready. That's a body's normal natural defense to kind of shut down the hunger drive when we're sick, okay? Because we don't want to feed the virus. We don't want to feed anything. We want to fight it. So we don't get too concerned if your child hasn't eaten much in a couple of days. They'll be fine. They'll get their appetite back and they will, you know, make up for lost time. And I'm talking about, you know, toddlers and up. If you have an infant or a baby, that's not the case. We want to keep very close eye on their weight. And if you're concerned, see your doctor, but understand that, you know, low appetite is not the end of the world, okay? And we have to be smart about the food we're giving. I can't tell you how many times in urgent care I'll have patients come in who are sick and the parents are like, oh God, they need to eat. So I'm going to give them McDonald's or a milkshake or pizza. And then they start throwing up and now their child is throwing up and they think something's wrong and they bring them in. And it's like, no, your body is fighting a battle right now. It cannot take that junk, okay? So do not eat junk food. Do not drink soda. Do not have pizza or hamburgers or Takis or anything like that when you're sick, okay? When you eat, make sure that you're fueling your body to fight. So soups and stews, broth, okay? You know, you can do things that are, if you can tolerate them, you know, protein rich, high fats like avocados and fish, like if you can tolerate them. But more times than not, we're doing like gluten-free crackers, we're doing broth, we're doing applesauce, we're doing, you know, grapes, like frozen grapes or something would be very soothing. My son was recently just sick and he really liked the frozen cherries, right? We did a lot of like whole food smoothies, okay? Those are the things we want to be pushing, but fluids. I hope I made that clear. And then be very, very judicious about the food that you stick in your body. Okay. If day 5 rolls around and you still have a fever over 101, or things are getting worse and not better, absolutely be seen, right? If 2 weeks later, all of your symptoms have gone away and you're still coughing, that could be normal. But if you're coughing up green stuff, if you are short of breath, if you're wheezing, if you're having a fever all of a sudden, that could be a bacterial pneumonia that you developed after a cold. If you have pain right here in one sinus, not all of them, one sinus, after you had the cold and all symptoms have resolved, you might have a bacterial sinus infection case. So you may need to see your doctor. You may need to go into urgent care. I just want to keep you guys out of urgent care and ER as much as possible, because we don't need to see every little cold that comes in, because then we're getting sick and we're bringing it home to our families. And there's not a whole lot that we can do about a cold. And I'm happy to educate my patients, but I don't have 45 minutes to argue with you about why I'm not giving your child antibiotics because they started with a sore throat 4 hours ago. Okay. So, try some of these things at home. Try to see your doctor if you can, because they can get you in and get you out. They know your case, and you're not sitting in a waiting room for 2 or 3 hours with a bunch of strangers who are coughing and vomiting and sharing other germs that you will likely go home with, since you're already, fighting another virus. Okay. Absolutely. If you're having shortness of breath, if there's any febrile seizures, if you think you're dehydrated because you are vomiting or diarrhea, then go into the emergency room, because most urgent cares cannot do IV replacement therapy. So that would be a good idea for you. Okay. So look out for the links below for all of these supplements that I showed you. And you can head over to my page. It's Illuminate Functional Wellness. Keep an eye out there. I'll make some more, videos as we go along, can answer any questions that you guys might have. And I'll also have links to the supplements on my business site as well. Okay. Stay healthy out there and enjoy your holiday season, everybody. Bye.